Viewer discretion is advised. Some slides may have visual effects that aren't always suitable for all audiences. We use the Emergency Medical Responder First on Scene for our Emergency Medical Responder course. We do not get paid to use this book, however, over the years, this course has been the easiest for our students to comprehend. Therefore is why we utilize it. This work is protected by the United States copyright laws and is provided solely for the use of our instructors to teach courses and assess the student learning process. The content on this website has been made available for our instructors to copy and distribute to our students in our classes as we see necessary. All education provided is a guideline to help you learn new concepts to better treat your patients. Your local protocol supersedes any education you learned in this course. You must always review with your medical director before changing your treatment plans that are outside of your local protocols. In this course, you're going to be able to define the following terms: anaphylactic shock, cardiogenic shock, compensated shock, decompensated shock, hemorrhagic shock, hypotension, hypovolemic shock, neurogenic shock, perfusion, psychogenic shock, pericardial tamponade, pulmonary embolism, septic shock, and shock. Explain the pathophysiology of shock, describe the 4 categories of shock, list the 7 main types of shock and their causes, and describe the signs and symptoms of shock. Explain the proper care of a patient presenting with signs and symptoms of shock. Demonstrate the proper techniques for caring for a patient at risk for shock, and value the importance of proper body substance isolation, BSI precautions, when caring for a patient with suspected shock. In this first section, we're going to learn about perfusion and shock. Perfusion is the adequate delivery of well-oxygenated blood and nutrients to the cells of the body, and proper elimination of waste products. Shock is also known as hypoperfusion. It results when one or more of these processes fail. During normal perfusion, oxygen, carbon dioxide, nutrients, and waste products are all exchanged properly. When these processes are interrupted for any reason, hypoperfusion develops and prevents these processes from occurring normally. Next, we'll talk about shock, also known as hypoperfusion. So it's the failure of the body's circulatory system to provide enough oxygenated blood and nutrients to all vital organs. Inadequate oxygen and carbon dioxide exchange, inadequate nutrient and waste product exchange, and fluid and salt imbalance. Shock can be life-threatening. The progression of shock can occur rapidly or over several hours to days. So care for patients with shock should not be delayed. If left untreated, blood loss will lead to shock and eventually death. So shock categories, we'll start out with cardiogenic shock. Cardiogenic is also a type of shock. Then we got distributive shock, which is neurogenic, anaphylactic, psychogenic, and septic. There's also hypovolemic, which is the hemorrhagic, obstructive, and respiratory and metabolic. Cardiogenic shock is when the heart or the pump is at the center of the circulatory system that must be functioning properly to maintain a proper blood pressure to circulate blood adequately. If the heart fails to pump an adequate amount of blood, the results can be abnormally low blood pressure, which will cause that hypotension. This category of shock sometimes is also referred to as the pump failure. So heart attacks as a cause of cardiogenic shock. So it can damage that heart muscle, which results in reduced force of contractions and reduces that cardiac output. So in the cardiogenic category, cardiogenic shock is when the heart is unable to pump enough blood at a consistent pressure to all vital organs. The next one we talk about here is distributive shock, which is where the blood circulates through the body by the way of a closed system of vessels. The vessels are then made up of smooth muscles and can dilate and constrict depending on the need of your body or the patient's body. Certain conditions can cause the vessels to dilate excessively, resulting in a much larger space than the available blood supply can actually fill. So when that happens, when there's more space within the system than blood to fill, the blood pressure drops, and that's when shock results. Shock can be caused by an uncontrolled dilation of the blood vessels. Okay, the next one, or the next two that we're going to talk about, is neurogenic shock and anaphylactic. So for the neurogenic, it is a form of the distributive shock, which is caused when the spinal cord is damaged and is unable to control the tone or the size of the blood vessels by the way of the sympathetic nervous system. So it's when the vessels are then allowed to dilate uncontrollably, and the dilation of the blood vessels actually cause an increase in the space within the circulatory system, which then in turn causes a drop in blood pressure, resulting in inadequate perfusion and shock. So then the second one, anaphylactic shock, that's just another form of the distributive shock. It's caused when the body experiences a severe allergic reaction, and this extreme reaction then causes the blood vessels to dilate uncontrollably, resulting in a loss of blood pressure, and thus you get the perfusion issues. Okay, next we're going to talk about psychogenic shock. So it is again another form of distributive shock. It often causes fainting. It usually occurs when some factors such as fear cause that nervous system to react and rapidly dilate those blood vessels. This then rapid dilation of the vessels is followed by a sudden drop in blood pressure, which then distributes the flow of blood to the brain. So in most cases, this is a self-correcting form of shock. So once the patient lies down, the situation will correct itself, and then the patient should return back to normal. So the last one is septic shock. It's another form of distributive shock, and it is a life-threatening condition caused by severe localized and system-wide infection of the body. The symptoms include low blood pressure, pale and cool arms and legs, chills, and difficulty breathing with decreased urine output. The mental confusion and disorientation may also develop really quick, and in other cases of shock, perfusion is then compromised, leading to signs and symptoms of shock with these. When you have a patient who has hypovolemic shock, hypovolemic means that it is low fluid volume. It includes all types of shock caused by the lack of adequate fluid in the body, where this then lacks of fluid can be caused by such things as bleeding, burns, vomiting, diarrhea, severe dehydration, but there must be an adequate amount of fluid within the body and the circulatory system at all times. If there's a significant loss of fluid volume, blood pressure will drop, and this may lead to the onset of signs and symptoms of, again, shock. In figure A here, you have the hemorrhagic or hypovolemia, which is the loss of blood. And then in B, you have the non-hemorrhagic hypovolemia, which is the loss of plasma and other fluids. We will also talk about hemorrhagic shock. So hemorrhagic is a form of hypovolemic shock. So it occurs when the body loses a significant amount of whole blood from the circulatory system, which it can be caused by uncontrolled internal or external bleeding. And when the blood loses significant amounts of blood, it can no longer maintain that adequate blood pressure or carry oxygen back to those vital organs. I know we already kind of talked about this, but it's always good to just recap. The next one is obstructive shock. This is sometimes referred to as a category and a type of a shock. So the adequate flow of blood can be disrupted due to a variety of obstructions to the heart, the lungs, and the great vessels. So the conditions such as pulmonary embolism and pericardial tamponade, tension pneumothorax, and trauma can all lead to obstructive shock. So the obstruction of blood flow reduces the perfusion, which then leads to, guess what? Shock. Okay. All right, so these are the pictures or the causes of the obstructive shock. In A is the pulmonary embolism, which is the blocked artery in the lung. B is the tension pneumothorax, which is the buildup of air that's inside the chest. And C is the pericardial tamponade, which is the accumulation of the fluid in the sac around that heart. So next we'll talk about respiratory and metabolic. So it is the disruption of oxygen transfer into the cells, or the cells are unable to utilize the available oxygen. It's caused by cyanide, carbon monoxide, or iron poisoning. So respiratory metabolic shock does not fall into a specific category of shock, but it relates mostly or closely to the definition of shock as being in a state of cellular dysauxia. With perfusion and shock, the body's response during the shock is the compensated stage and decompensated stage. So the main focus is to prevent the patient from entering the decompensated stage of shock. So during the response of shock, it is the human body's ability to adjust and compensate when things go wrong. So in the case of shock, sophisticated pressure receptors throughout the circulatory system can detect the slightest change in blood pressure. Those are what's called the baroreceptors. So these receptors can actually detect that change in the blood pressure long before any outward signs of shock actually appear. So when we talked about blood pressure goes down, pulse rate goes up, heart rate goes up, that's those early signs of shock. So in the early stages, that's when the sympathetic nervous system is activated and causes such things as increased heart rate, constriction of the blood vessels, increase of the heart contracting, and all of these things work together to help maintain an adequate pressure, which is necessary for that perfusion. So all of these changes are all a part of what is commonly referred to as the compensated shock, because there's the ability for the body attempting to compensate for that drop in the blood pressure. So as the body detects the slightest drop in the pressure within the circulatory system, it actually releases hormones such as epinephrine that will increase the heart rate in an attempt to maintain that blood pressure. So if that increase in the heart alone is not enough to maintain a good blood pressure, then additional hormones are released that will constrict the blood vessels in that non-essential areas, so such as the skin and the intestinal tract, which then the constriction of these vessels will then redirect the blood to the vital organs where they're actually needed to focus on. So your early signs and symptoms of shock are restlessness, altered mental status, increased heart rate, normal to slight low blood pressure, mildly increased breathing rate, skin that is pale, cool, and moist, sluggish pupils, nausea, and of course, possibility of vomiting. Typically, your patient will experience anxiety and mental status changes. The brain then begins to feel the effects of that decrease of oxygen. They can also have that cool, pale skin, that's sweaty, and an increased pulse and respirations. That's when the blood is shunting from the skin to the vital areas, and that pulse and respirations increase to compensate for the shock that they're in. And of course, in addition to sweating, the patient may also experience that nausea and vomiting as blood is shunted from the intestines to those more vital organs. So if the root cause of the shock is not corrected soon enough, the body compensates, and that's when their compensatory mechanisms will begin to fail because they are either not receiving adequate perfusion or there's things going on within the body that need to be fixed. When this happens, the heart rate will begin to slow down, the breathing slows down, the blood pressure drops to a very dangerous level, and then the failure of the normal compensatory mechanisms is referred to as that decompensated shock. So if the root of that shock is not cared for soon enough, the patient will eventually enter a condition that's called irreversible shock and essentially will die from that. Signs and symptoms of a decompensated shock patient are going to be unresponsive, decreased heart rate, very low blood pressure, slow and shallow respirations, skin that is pale, cool, and moist, dilated, sluggish pupils, and respiratory and cardiac arrest can actually then develop after that. A drop in blood pressure is a late sign of shock, so that's why you want to be sure that you're always taking blood pressures every 5 minutes on that unstable patient just to get a trend going to see if that blood pressure is dropping throughout. In this section, we're going to talk about the mechanism of injury and shock. One of the keys to successful care of trauma patients is to operate on the assumption that bleeding is likely based on the mechanism of injury. You do not want to wait for any signs or symptoms to develop before you begin caring for a patient in shock. So in cases of trauma or injury, you want to examine and consider the mechanism of injury very carefully. If there's any chance that the patient may have sustained blunt trauma to the head, chest, abdomen, or pelvis, you want to suspect that the internal bleeding exists and care for that patient accordingly. Of course, you must also identify and stop any external bleeding immediately upon discovery. Caring for shock, you're going to perform your primary assessment, ensure your ABCs are properly supported, control any external bleeding, administer oxygen per your local protocols, keep the patient in a supine position, calm and reassure that patient, and maintain normal body temperature. You're also going to monitor and support the ABCs. Do not give that patient anything by mouth, and monitor their vital signs. The next one we'll talk about is fainting, which is also known as syncope. It is usually a self-correcting form of a mild shock, also called psychogenic shock. However, the patient may have been injured in the fall due to the fainting. So be certain to examine that patient who has fainted for any other additional injuries. Even if no other problems are apparent, keep that patient lying down and at rest for several minutes. Fainting can also be a warning of a serious underlying condition, such as a brain tumor, heart disease, or diabetes. So always recommend that the patient see a healthcare provider as soon as possible if she or he experiences a fainting spell. And sometimes it's easier to get a patient to go in by personal vehicle rather than be transported by an ambulance. If you can get them to go to the doctor any way you can, that is the best for that patient, no matter which means of transportation they get there. Guess I got a little bit ahead, but you always want to recommend that they see that physician, and then fainting may be psychogenic or due to more serious conditions such as a brain tumor, heart disease, or diabetes. All right, we're going to go through a quick summary of what we learned in this chapter. You learned what perfusion is, which is the adequate supply of well-oxygenated blood and removal of the waste products from the body's tissue, especially vital organs. You learned that shock is also called hypoperfusion. It's the failure of the body's circulatory system to provide enough oxygenated blood and nutrients to all vital organs. Signs and symptoms of shock can be increased pulse, increased breathing rate, restlessness or combativeness, pale, cool, and moist skin, thirst, weakness, nausea and vomiting, and loss of responsiveness. Types of shock include cardiogenic, hypovolemic, distributive, obstructive, and always begin caring for shock if mechanism of injury suggests internal injury or bleeding. Do not wait for signs and symptoms to appear before caring for shock. Care for shock by supporting the ABCs, keep the patient lying flat, and control all external bleeding. If you have any questions on this chapter, please feel free to reach out at any time. Otherwise, we will discuss all of this and go through all this additional information in your skills testing.